Hello, we are here today with Professor Anita Arsovska from Republic of North Macedonia. She's a SAFE board member and she's a very prominent figure in her country regarding stroke. Professor Anita, can you please tell us more about yourself?
Well, as you said, I'm a stroke physician. I'm head of department for urgent neurology at the University Clinic of Neurology in Skopje, Republic of North Macedonia. I'm also professor of neurology at the Medical Faculty, University Cyril and Methodius in Skopje, Republic of Northern Macedonia. I'm also fellow of the European Stroke Organization and board member of SAFE. I'm also president of the Macedonian Neurology Society.
Well, obviously this is very impressive. Obviously you are a very, very busy expert in this field. And our today's topic is one of topics that are strictly from your field of expertise. It's about atrial fibrillation, irregular heart rhythm, and how it's connected to stroke. Can you please tell us more about this condition and if it's dangerous, how dangerous it is?
Atrial fibrillation is an abnormal heart rhythm that is characterized by rapid and irregular beating of the atria. Often it starts as brief periods of abnormal beating, which become longer and possibly constant over time. Often episodes of atrial fibrillation have no symptoms at all. Sometimes patients can experience heart palpitations, fainting, shortness of breath, or even chest pain. Atrial fibrillation is one of the modifiable risk factors for stroke. Also, atrial fibrillation increases the risk of heart failure and dementia.
Is there a way for us, for regular people, to discover that we have this condition or we have a risk for this condition?
The most important thing to discover atrial fibrillation is measurement of the pulse. So every person can take the pulse, but also it is necessary to do the necessary electrophysiological investigations, such as electrocardiogram, and usually it is suggested that people should be monitored for any abnormality in the heart rhythm. And besides electrocardiogram, we also suggest that patients should be investigated with echocardiography and sometimes with long-term monitoring of the heart rhythm.
All of this sounds a little bit complicated, and I remember I read somewhere that quite often this condition's first symptom is stroke, because people may or may not recognize symptoms before something major happens. So these investigative procedures that you just mentioned, they are done in hospitals or healthcare centers, and pulse checking is something that we can do. So how accurately can we measure our own pulse, and when should we definitely go to see medical help for this?
Well, as you said, sometimes the atrial fibrillation can be silent and people are not aware that they have this condition. However, sometimes if they feel some of the symptoms that I have already said, like heart palpitations or shortness of breath or even chest pain, then they should see their GP, and then afterwards the GP would direct them to see their cardiologist. Sometimes we as neurologists are the first doctors that discover atrial fibrillation after patients are admitted to our hospital with ischemic stroke, and on ECG we find that they have atrial fibrillation. So of course we consult our colleagues from the Clinic of Cardiology.
How is this condition, how is atrial fibrillation connected to stroke directly?
The atrial fibrillation is an abnormal beating of the heart and increases the possibility of formation of clots within the blood. So these clots can then travel through the bloodstream to other arteries in the brain, and they can obstruct the blood flow in the brain, and that way they can cause an ischemic stroke. And usually these ischemic strokes are larger in their territory in the brain, and they are sometimes more severe than other types of stroke and tend to have more hemorrhagic transformation.
Okay, but how often are these strokes comparing to other types of strokes?
Well, it is considered that atrial fibrillation is responsible for up to 25% of all ischemic strokes.
And there are for the sake of comparison, ischemic strokes are more often than those who are caused by
hemorrhagic. Yes, yes. Like in the general population, in our patients, 80 to 85% of all strokes are ischemic strokes of ischemic origin, and 10 to 15% of strokes are due to hemorrhage in the brain.
Okay, so obviously atrial fibrillation is a very serious condition that cannot be taken lightly and should be treated. Are there any effective ways of treatment, and is this treatment complicated to follow?
There are guidelines that are recommended for patients who have non-valvular atrial fibrillation and stroke, and those guidelines suggest that after we diagnose this condition, these patients should be treated with anticoagulation therapy. So the guidelines, not only of the Neurology Society, but also from the Cardiology Society, are very strict when they say that antiaggregation therapy, such as aspirin, is not efficient in such patients. So these patients should be treated with anticoagulant therapy. There are rules when to introduce the anticoagulation drug that is taken PEROS or oral anticoagulation therapy according to the severity of stroke. So if the patient has a minor stroke or transient ischemic attack, the anticoagulation drug could be introduced after one day. So if the stroke is moderate, then after 3 to 6 days. If it is a severe stroke, after 9 days. And for example, if it is a hemorrhagic stroke, then the rules say that it is safe to introduce anticoagulation therapy after maybe 10 weeks to up to 30 weeks, depending on each individual case. And when we talk about the anticoagulation therapy, there are two types. The old ones, the vitamin K antagonists, such as warfarin or Sintrom, are the old drugs that are still used in the world. However, we and the guidelines prefer the novel, the new or direct anticoagulant drugs such as rivaroxaban, dabigatran, apixaban, and edoxaban, which have less side effects. That meaning that they have less hemorrhagic transformations of the strokes, and also patients are better. Their neurological status is much improved when they take these drugs. So they have less interactions with drugs, less interactions with food, like for example Sintrom and warfarin. They have a lot of limitations and a lot of side effects. But the problem is, for example, in my country, that these new oral anticoagulant drugs are not on the so-called positive list. So people have to buy them and spend like 80 to 90 euros per month. And that's why they are not so widely used as they should be in the everyday practice.
Okay, so it's a huge obstacle if drugs are not being reimbursed by the state, because it's not quite often it's not the only drug that stroke survivors need to use, and if they have to buy each and every one of them, that might affect their family, their home budget significantly. Is atrial fibrillation something that a person can be cured from, or are these therapies for life? How long should a person take this therapy?
Usually, the person has to take the therapy for life. There are also other procedures like surgical procedures that are applied in certain patients. However, cardiologists are more qualified to talk about these procedures. Regarding the anticoagulation drugs, the new novel anticoagulants drugs have less side effects. So they are, if the patient can take them, they should be taken throughout his whole life to prevent stroke. It is always important to have an individual approach to each and every patient, to calculate the risk factors, to calculate the risk for a consecutive stroke. So we sometimes use these scales like CHATS-2 and CHATS-VASc2 scores, so we can accurately predict the risk of stroke that a patient with atrial fibrillation can develop. So that's how we decide the duration of the anticoagulant treatment.
Okay, thank you. You mentioned how things are in your country. Epidemiologically speaking, where is your country comparing to other countries? What is the number of people with AF in your country? Do you have these numbers? And are these numbers big or small?
Well, as far as stroke is concerned, my country is considered in a group of countries with a moderate incidence of stroke. And since we are involved in the rescue registry since 2 years ago, now we are able to accurately see what is the percentage of patients who have atrial fibrillation. So also our numbers are comparable with numbers in other European countries. So approximately 22% of our stroke patients have diagnosed atrial fibrillation.
Thank you. These numbers are still very high. So a lot of things need to be done. First of all, as you mentioned, we should be compliant to therapy. When a doctor says that we have to take the therapy, then we really have to take it. Otherwise, the risks are huge and unnecessary. Thank you for today's conversation. This has been very informative and helpful. We have been talking today with Professor Anita Arsovska from North Macedonia, SAFE board member and a fellow member of European Stroke Organization. Thank you very much.
Thank you, Jelena.